Hi, this is the last week of the legislative session before cutoff for policy bills, and we've had quite a bit happening. Probably a highlight was floor action yesterday when we honored the Washington State National Guard, and we paid particular attention to the widow and infant son of Sergeant Matthew McClintock. Sergeant McClintock was killed in Afghanistan recently, and after the floor session, his widow, Alex, came into our caucus room and shared some stories about Sergeant McClintock. And I can tell you I've never had a more moving experience inside that caucus room than when she talked about her husband and the way that he gave his life, rushing towards danger in order to save someone. And she also talked about the other heroic member of the Washington State National Guard who risked his own life to bring the body of her husband back. We have weighty and important issues to deal with here in the state of Washington and in the legislature, but you have moments like this once in a while that help you understand that the people of Washington and the people that serve our country have equally weighty things, and many of them are life and death, and I'm so grateful for the people that serve our country and keep all the rest of us safe. Along with the important moment, we also have a budget to be concerned about. And one of the things that is making this a difficult budget year is that we have so many failures in terms of our assumptions about how the Affordable Care Act was going to work in Washington. We are having to cut a number of other programs in order to pay for health care. One egregious example is a program that was forecasted to save $47 million has actually saved only $1.5 million. And so almost $50 million is going to have to be allocated back into health care and can't be used for some of the other important programs that we have in the state of Washington. And of course, we have other areas that are demanding additional resources. That includes paying for the fires, almost $200 million for that, improving the egregious performance in the Department of Corrections, and also trying to understand why we have had a near collapse in the management of parts of our mental health system. We have some successes in mental health too, and one of the things that we would like to invest and expand in is being able to integrate rural mental health so that people that are facing challenges don't have to simply migrate to a city. They can receive treatment where they live in a rural or suburban area. We also had one very happy day down in Olympia this week when we were able to recognize the 2nd District's own Nisqually tribe, the Nisqually Tribal Council, and also Chairman Farron McLeod, who came down to the legislature to invite all of us to the Paddle to Nisqually. This is an important event for Native people all over the Pacific Northwest, and between 15 and 20,000 people are going to visit the 2nd District in connection with this event. It's taking place between July 30th and about the middle of August. There is a website, and if you Google Paddle to Nisqually, you can join the fun as well. Thanks, everybody.